Good morning. Assalamu alaikum. Today we will speak about three microorganisms, three bacteria, which are very important in relation to UGS. Chlamydia, Gardenalia, and Ureaplasma. The learning objectives of this lecture to describe the differences in structure, morphology, and replication of these three organisms, of these three bacteria from other bacteria. So these are a special entity of bacteria, not the usual ones that we know. We are going to describe the pathogenesis, and we are going to concentrate on the virulence factor and their implications in the clinical picture of the diseases caused by these three types of bacteria. Describe the laboratory diagnosis and the treatment accordingly, just broad lines or a few lines. You can say highlights of the treatment. Starting with the first bacteria is the Chlamydia, is obligate intracellular bacteria. Look to the word obligate intracellular, cannot live outside cells. These bacteria are characterized by lacking peptidoglycan in the cell wall. So they don't have peptidoglycan. What is the implication of this point to us as doctors? The implication that you cannot use antibiotics which act on the cell wall because will be inactive, like the penicillins, cephalosporins, which act on the peptidoglycan in the cell wall. Therefore, one should not prescribe these antibiotics in infection of chlamydia. There are three important species, and we will see more details of it. Three important species, Chlamydia trachomatis, which will be considered during this lecture, Chlamydophila pneumoniae, and Chlamydophila psittaci, or some people pronounce it psittaci. Chlamydophila pneumoniae and psittaci has been covered to you, presumably, of course, with the RS, with the respiratory system. So today we will talk in relation to UGS about the Chlamydia trachomatis. Chlamydia trachomatis are round cells. You can see them, the brown ones, round cells, okay? Gram-negative. Although they don't have the cell wall, but from other types of a study, they found them to be related to gram-negative. The important thing that they have major outer membrane protein, MOMP, major outer membrane protein, and we will deal with this factor during the lectures. So Chlamydia is the genus, Trachomatis is the species. This type of bacteria has got biovars, subdivision, more subdivision, according to their antigenicity. The biovars, which are A to C, that is to say A, B, and C, infect ocular epithelium, cause trachoma, مرض التراخوما بالعين. وعارفين شو هو مرض التراخوما. So A to C infect ocular العين, ocular epithelium. D to K target UG, urogenital epithelium, and can cause non-gonococcal urethritis or non-specific urethritis, with also mucopurulent cervicitis or proctitis. Or proctitis is inflammation of the rectum, right? Proctitis is inflammation of the rectum and can cause also inclusion conjunctivitis. So they can cause non-gonococcal urethritis, cervicitis, proctitis, and conjunctivitis, inclusion conjunctivitis. The biovars L1 to L3, that is to say L1, L2, L3, infect genital and colorectal region and can cause lymphogranuloma venereum, LGV. Lymphogranuloma venereum, and we will talk in details subsequently during the lecture about lymphogranuloma venereum. This table summarizes to you what I have said. Trachoma, Chlamydia trachomatis, and we have said it has biovars A, B, and C, can cause conjunctivitis, reservoir human, the transmission hand to eye, or fomites and the flies. Fomites أبخرة إلى آخره. The disease can cause conjunctivitis complication, can lead to blindness, العمى. D to K, Chlamydia trachomatis برضو, the cells tropism to urogenital, we said. Reservoir, again, human, can be transmitted by sexual and perinatal, can cause non-gonococcal urethritis, cervicitis, and proctitis, as I mentioned. Complication, PID, pelvic inflammatory disease, and can lead to infertility. So part of the infertility investigations that we do is to check for infection with Chlamydia trachomatis. The three L's, L1, 2, 3, again, urogenital, colorectal, reservoir human, transmission sexual here, and can cause lymphogranuloma venereum, ulcers, and lymphadenopathy. As I mentioned, Chlamydophila psittaci and Chlamydophila pneumoniae has been dealt with in the RS, in the respiratory system. Both can cause pneumonia. Now, Chlamydia trachomatis, a clinical capsule, primarily produce infection where? In the conjunctiva or in the genital tract. It depends on the biovars, and we mentioned that. Trachoma, مرض التراخوما, is a progressive conjunctivitis with inflammation and scarring leading to blindness. التراخوما تشوفوها على شكل حبيبات في داخل الجفن. لو واحد يقلب الجفن للخارج راح يشوف حبيبات pale yellow or yellowish sometimes. These are the trachoma lesions. Genital biovars are most common cause of sexually transmitted what? Urethritis, cervicitis, and salpingitis. What is salpingitis? Is an inflammation of the fallopian tubes. Also, these biovars, the genital biovars, when inoculated in the eye, can cause also acute conjunctivitis. Yani not only those which we have mentioned, A, B, and C can cause conjunctivitis. These also, the genital biovars, D to K, when inoculated in the eye, they can cause conjunctivitis. Therefore, when aspirated by a newborn during delivery, can cause pneumonia. Again, that is why we have to screen women for these bacteria before delivery. Lymphogranuloma venereum biovars, the three L's, L1, L2, L3, can cause localized ulcerative genital lesions. With what? With regional lymphadenopathy. So remember, can cause localized infection, ulceration, ulcerative genital lesions with lymphadenopathy. Replicative cycle. Now the replication. There are two major forms of Chlamydia trachomatis regarding their replication. Elementary bodies, EB, and reticulate body, RB. So we are speaking about EB and RB. The elementary bodies are characterized being small, hard forms, inert, صلبة, لا تتفتت. Cycle started by EB attachment to a plasma membrane of the infected cells. Then endocytosis, elementary bodies will enter inside the cells. Then once entered inside the cells, they become reticulate body, RB, which are larger, fragile, تتكسر. Intracellular replicative form, that is to say they replicate and then condense, multiply. Once they become in huge numbers, they will be exocytosis. تخرج خارج الخلية، تنفجر الخلية وتظهر إلى خارج الخلية. So you can see here these pictures, chlamydia life cycle. This is fluorescent staining. Look, these are the cells, the red ones are the cells, and the green one, these are the Chlamydia trachomatis. The other magnification here, which is a transmission electron micrograph, you can see that we have the different forms. This is the elementary, the black arrow. The white arrow is the reticulate forms, larger, fragile, while the elementary are condensed, hard, soluble. And there is a form which is intermediate between the two, between the reticulate and the elementary. These are called aberrant bodies. The black arrowhead, هذا رأس المؤشر فقط here, called aberrant bodies, intermediate form between the reticulate and the elementary. This slide is very important. This slide shows us the differences between the elementary body and reticulate body. Look to the picture, small and dense, larger and fragile. So the size, 0.3 micron, while the reticulate body, 0.5 to 1 micron. Rigid cell wall, fragile cell wall. Relatively resistant to sonication, تقاوم الموجات الصوتية. لو واحد يعرضها إلى جهاز للتفتيت sonication, تقاوم, resistant to sonication. That is to say, they are not broken by sonication, while the reticulate body are sensitive to sonication. Elementary body resistant to trypsin, while the other reticulate lies by trypsin enzyme. RNA to DNA ratio content 1:1. RNA to DNA content for reticulate body 3:1. Toxic to mice, non-toxic to mice, reticulate. Isolated organism infectious, isolated organisms are not infectious. They are just going to replicate and then multiply and exocytose. So they are, until they become expelled outside and turn again to be elementary body, they are not infectious. Adapted to extracellular cervical, yes, elementary body extracellular, while reticulate body adapted to intracellular growth. And you can see them here in the picture. Elementary body, then they are phagocytosed, endocytosed, we say, endocytosed, become reticulate body, multiply by binary vision, انقسام, انشطار, and then they multiply so many, lysed phagosome, and the plasma membrane also lysed, and then expelled outside in exocytosis or process. This usually occurs within about 48 hours. Epidemiology about Chlamydia trachomatis prevalent in USA, for example, generally speaking, 5%. Up to 20% among patients attending sexually transmitted disease clinics. It is more common in those patients who have sexually transmitted diseases. But among the general population, only 5%. Among this group of patients, 20%. 1/3 of men with sexual contact with infected female, for example, have cervicitis, will develop urethritis. During what? During a period between 2 to 6 weeks. That is to say, the incubation period is 2 to 6 weeks. That is to say, if a patient gets contact today, after 2 to 6 weeks may manifest the signs and symptoms of urethritis, which we have described previously. Sometimes the symptoms could be absent or just mild symptoms, not always detectable, or the patient become aware about it. Pathogenesis, this bacteria has a tropism, that is to say, would like to go to. Tropism to columnar epithelium of the genitourinary tract, also rectum, conjunctiva, and also other tissues. But the main ones, GUT, rectum, and conjunctiva. Attachment occurs via what? By MO, MP, major outer membranoprotein. In lymphogranuloma venereum, however, the bacteria enters via break in the skin and the mucous membrane. That is why it is common in homosexuals. And I will speak about it. Tissue injury occurs by pro-inflammatory cytokines. Once the bacteria attach to the body and start its infection, pro-inflammatory cytokines will be released just in preparation to get encountered with the bacteria. Pro-inflammatory cytokines. Pro-inflammatory cytokines like interleukin 1, interleukin 6, tumor necrosis factor. هذه فقط أنا just to refresh your memory from your immunology. Pro-inflammatory cytokines, and also interleukin 8, IL معنى interleukin 8. Interleukin 8 is chemotactic factor, bring cells to help in the immune response, chemotactic. So pro-inflammatory cytokines, interleukin 8 are released by the infected epithelial cells. The chlamydia lipopolysaccharide also leads to cellular infiltration. There will be cells of the immune system comes to the area to attack the bacteria. Some of them part of the innate immunity, non-specific immunity. Some of them are part of the adaptive immunity, which is the specific immunity. Macrophages, part of the innate immunity. Lymphocyte may aggregate at the submucosa, leading to what? Leading to necrosis and scarring. Scarring يعني بعد الانجري يصير سكار يعني منطقة تليف. Later stages, immunological response to chlamydial antigen can occur in the form of what? I will describe it. Long time to develop the immunity. It takes long time, not within a short period you get immunity against Chlamydia trachomatis. It will take some time to develop. Then it is incomplete. مو ذيك المناعة الكاملة. ولهذا السبب recurrence is possible. 50% of infected women shed the organism. وحكينا امبارح على shedding. Shedding يعني تطرح الorganism outside the body, called shedding. For 1 year later. The T cell immune response, we said intracellular, obligate intracellular bacteria, like Chlamydia trachomatis. Of course, it will be attacked by the T cells because this is the responsibility of the cell-mediated immunity. Th1 is the most protective, while Th2 is directed to MOMP and proteins. Antibodies can cause injury in chronic cases. Also, antibodies can be formed. How the antibodies are formed? When the cells which are infected rupture and you get the elementary bodies outside, antibodies will be formed. When the organism become extracellular. So the antibodies are stimulated and formed when the bacteria become extracellular. Here scanning electron micrograph, the chlamydia is here. These are the large cells. This part of the body is the fallopian tube mucosa. You can see the microvilli of the fallopian tube mucosa. And the chlamydia will attach to these microvilli via MOMP. Genital infection manifestation. We are not going to speak more about conjunctivitis because you will deal with it in ophthalmology later on, but just it can cause a trachoma. Our main subject today is about UGS. So urogenital by biovars D to K. In men can cause urethritis epididymitis. So if you have a patient with epididymitis, you should think about Chlamydia trachomatis. And this you will deal with it, inshallah, with your clinical training in the future. So remember, I've told you that Chlamydia trachomatis in men can cause urethritis and epididymitis. In women, can cause cervicitis, salpingitis, and urethral syndromes. Complicated by what? By PID, pelvic inflammatory disease and infertility. That is why I said if you have a case of infertility, you should investigate also for infection with the Chlamydia trachomatis. Lymphogranuloma venereum, biovars L1, L2, L3 are the causative agent of LGV. It's a chronic infection of lymphatics and lymph nodes accompanied by lymphadenopathy. We will talk about it more. Patient will suffer when he has got or she has got urethritis, dysuria with thin discharge, cervicitis, vaginal discharge. Commonly, Usually it is asymptomatic. What is pelvic inflammatory disease, PID? In 5 to 30% of Chlamydia trachomatis infection in women accompanied by or complicated by PID. It is an infection of what? Of the uterus, fallopian tubes, that is to say, salpingitis, ovaries, and inside of the pelvis. So when we say PID, we mean infection of the uterus, fallopian tubes, ovaries, and some other organs inside the pelvis. We call them pelvic organs. Scarring, chronic and repeated infection. حكينا أنه repeated infection is common because the immunity that is developed against chlamydia is incomplete, leading to what? Leading to sterility due to scarring, and also leading to ectopic pregnancy because fallopian tubes are scarred. Some of them are blocked. That is why there is what we call ectopic pregnancy, يعني حمل خارج الرحم. Ectopic pregnancy, خارج الرحم, pregnancy. Now we come, as I promised you, we are going to speak about lymphogranuloma venereum, LGV. It's transient genital lesion, multilocular suppuration of inguinal lymphadeno, of inguinal lymph nodes. These become suppurative, تتقرح. The primary lesion, small painless, remember, lymphogranuloma venereum, painless. Ulcers or papule just appear for a few days and heal, sometimes unnoticed, بدون ما يحس المريض بها. Sometimes accompanied by systemic manifestation like fever, loss of appetite, tiredness, myalgia, headache, etc. Complication, urethral and rectal strictures. Due to what? Due to lesion and then scarring. So you get urethral and rectal strictures. انسدادات يعني strictures. من يصير عندك سكار أكيد يصير عندك فد مكانات تضيق أو انسداد. Perirectal abscesses and fistula. These are complications of the lymphogranuloma venereum. You can see here in the picture the lymph nodes, bilateral, and these become suppurative. تفرز مادة قيحية. These are common in MSM, homosexual men, and they develop, these people, unfortunately, hemorrhagic ulcerative proctitis. Lymph node aspiration prevent rupture. Sometimes these lymph node, because of suppuration, if you don't aspirate them, يعني سحب القيح منها, they are going to rupture and cause more damage once they are ruptured. Diagnosis of chlamydia: to make a smear examination or culture. The specimen, what specimen we take from the patient? We take urethral discharge, or we can take cervical epithelial cells. Cultures, we can see inclusion bodies detected by immunofluorescence. شفتوها الصورة بالبداية, الخلايا الحمر and the green chlamydia. These are inclusion bodies of Chlamydia trachomatis inside the cells. Culture, it takes a bit long time, 3 to 7 days. The other method is the direct fluorescent antibody and immunoassay methods. These are also better methods, more fast to detect the chlamydia infection. More specific and more sensitive is a nucleic acid amplification test, which has replaced other tests. And yesterday I have spoken about NAA. Lymphogranuloma venereum, there is a test called complement fixation test or complement fixation antibody test. If you get a titer more than 1/32, it is positive, considered positive, which is present in 80 to 90% of infected people shortly after inguinal lesions appear. So complement fixation antibody test is quite good. NAA test, nucleic acid amplification test, quite good. Fluorescent test, immunoassay also are good. These are technically requires some equipments and skills. Treatment, tetracycline, macrolides, and fluoroquinolones. Azithromycin is part of the macrolide first-line therapy, single oral dose for non-lymphogranuloma venereum. إذا الكيس Chlamydia trachomatis, azithromycin. Doxycycline first line for lymphogranuloma venereum. فإذا الازيثروميسين for non-lymphogranuloma venereum. Doxycycline for lymphogranuloma venereum. Erythromycin, the general one, erythromycin and the fluoroquinolones are alternatives if you don't have these antibiotics, the azithromycin or doxycycline. Prevention, infected pregnant women can take erythromycin in late months of pregnancy, not early, because early may cause damage to the fetus. So infected pregnant women, they can take erythromycin just to prevent the spread of the microorganism to the child during delivery. Of course, general hygiene will be very important. We go to the second bacteria, which is Ureaplasma. Ureaplasma with another bacteria called Mycoplasma. I am sure you have heard about Mycoplasma because Mycoplasma can cause pneumonia, as you know, which is called walking pneumonia. Ureaplasma and Mycoplasma are called molecules. Both organisms together are called molecules. These are prokaryocytes lacking cell wall. Ureaplasma has no cell wall. Mycoplasma also has no cell wall. But they have, instead of that, a trilaminar membrane. يحيطها membrane ثلاثي. Trilaminar membrane containing sterol, which is acquired. Once the cells, the infected cells rupture, they take part of the membrane of the infected cell, which contains sterol. This is versus other bacteria. Other bacteria cannot do it. That is why I said from the beginning we are dealing with special types of bacteria. Both the Ureaplasma and Mycoplasma belong to a family called Mycoplasmataceae. This is just to show you that these two organisms are linked together. Both are called molecules. They are sexually transmitted disease. High frequency of asymptomatic cases. As Chlamydia, asymptomatic is common. Of what? Of urethritis, cervicitis, PID. I described to you what is PID, pelvic inflammatory disease. Ureaplasma are very small, highly solid, sometimes described as highly plastic, a pleomorphic appearance. شو معناته pleomorphic? Have or has variable shapes, متعددة الأشكال. Like what? Such as coccoid bodies, مكورات, filamentous, شرائط, or bottle-shaped in appearance. So such changes in the shape of the organism, we describe it a pleomorphic morphology. These organisms do not stain well or poorly stained. They are derived from gram-positive bacteria because they don't have cell wall. And we mentioned for chlamydia, they are derived from gram-negative. Ureaplasma derived from gram-positive, together with the mycoplasma. How we differentiate between ureaplasma and mycoplasma? Ureaplasma are urease positive, while mycoplasma urease negative. This is very important point. You should concentrate on it. Ureaplasma, urease positive. Mycoplasma, urease negative. This bacteria has got a small double-stranded DNA genome. The species, there is a species of Ureaplasma. Ureaplasma is a genus. There is a species, Ureaplasma urelyticum. Ureaplasma urelyticum. Sometimes it is described as T mycoplasma. احنا حكينا في ترابط ما بين اليوريابلازما والميكوبلازما. T mycoplasma, it means Ureaplasma urelyticum. T stands for tiny, very tiny. And there is another species, Ureaplasma partum. You can see now Ureaplasma urelyticum grown on Ureaplasma agar, which is very specific and special agar. The growth is embedded inside the agar, يعني تحت السيرفس ولو هو ظاهر للعيان, but it is underneath the surface of the agar. When you examine them under a transmission microscope, you will find dense coccoid forms are present in young colonies, right? So this is Ureaplasma urelyticum, which is called T mycoplasma. This table shows you the mycoplasma and ureaplasma. Also, mycoplasma pneumonia and the other mycoplasma pneumonia related to the respiratory. Another mycoplasma, these species, I don't want from you the species hominis, fermentans, and genitalium, can cause urogenital infection in the form of cervicitis, prostatitis, PID, the other urethritis, cervicitis, PID. But our concentration during this lecture is on Ureaplasma urelyticum. Again, the primary site is genitourinary, can cause the same diseases, urethritis, cervicitis, and PID. Ureaplasma parvum, genitourinary, can cause the same diseases also. So you can see here, both mycoplasma and ureaplasma related to genitourinary tract and can cause these diseases which are in front of you. But remember, this one, fermentants, can cause urethritis only. Treatment of ureaplasma infection, again, macrolides, azithromycin, clarithromycin, also erythromycin, the general one. Tetracycline also can be used, in particular doxycycline, which is the long-acting tetracycline, can be used once daily. Fluoroquinolones, again, alternatives, similar to what we have said with the chlamydia. The last organism, the last bacteria, Gardenalia. These are a gram variable. شو معناته gram variable? sometimes positive, sometimes negative. Small, non-motile coccobacilli. They are longer than the cocci, shorter than the bacilli. In between form called coccobacilli. It has a gram-positive gram-positive bacterial cell wall. Although I am saying a gram variable in staining, but by study, they are derived from, as we mentioned for the other microbes, they are derived from a gram-positive bacteria. And the cell wall is very thin. That is why they are gram variable when we do staining in our lab. It is facultative anaerobic bacteria. The important species of Gardenalia is Gardenalia vaginalis. So G. vaginalis. It is associated, look to the word, I put it in yellow, associated with bacterial vaginosis. This bacteria is not the causative agent, is associated with bacterial vaginosis together with other anaerobic bacteria, but it does not cause it. It does not cause bacterial vaginosis. It is associated with bacterial vaginosis. It is involved in the pathogenesis of bacterial vaginosis, but is not the causative agent of it. It is sexually transmitted disease. I hope this point is clear to you. Manifested with vaginal discharge and fishy odor, bad odor. This is very characteristic of the microbe, and there is a test called amino whiff test. If you add this substance, amino whiff test, with 10% KOH, if you add 10% KOH to the vaginal discharge, it will produce fishy odor. طريقة سهلة. Vaginal discharge, you add a drop of 10% KOH and you get very bad odor. This is an indication that there is Gardnerella infection, in particular Gardnerella vaginalis. So remember, amine whiff test. There is very important point in the diagnosis, in the laboratory diagnosis, is associated with clue cells. These clue cells are epithelial cells covered with bacteria. Look at them. These are epithelial cells covered or attached to it the Gardnerella, stippled appearance. Stippled معناتها مرقطة, كأنما مرقطة. This is a real picture. I have taken this picture from one of my patients. Covered by bacteria Gardnerella. These are called clue cells. Remember, clue cells are very useful in the diagnosis of Gardnerella infection and Gardnerella vaginosis, bacterial vaginosis. These microbes produces pore-forming toxin, vaginolysine, and other enzymes such as proteases that can cause damage to the infected cells. Treatment, metronidazole and clindamycin. These can be used as oral drugs or can be used as vaginal gel or cream. By this, we end this lecture. Any question, any comment?
دكتور بدي أسألك هسه المايكوبلازما البليومورفيزم تبعها شو السيجنيفيكانس إله؟
المايكوبلازما ما حكينا عن المايكوبلازما
اللي هي اليوريا بلازما.
اليوريا بلازما على قصدك على اليوريا بلازما مو على المايكوبلازما.
مزبوط.
على اليوريا بلازما بليومورفيزم من تعمل انت سمير تعمل ستينينج راح تشوفه متعددة الأشكال، كوكوباسيلاي، فيلامنتس، bottle shape. Other microorganisms could be pleomorphic also. Haemophilus influenzae type B is also pleomorphic, has coccoid and filamentous forms. This is not characteristic for the ureaplasma only. Other microbes can show it, like Haemophilus influenzae. So their morphology is pleomorphic, can be described.
شكرا. واضح.
نعم. Other question?
دكتور.
نعم.
لما حكينا آخر إشي عن الجراد رينيلا حكينا إنها كان be associated with other bacterial vaginosis. هل المقصود إنها لحالها it's weak يعني cannot cause vaginitis؟
لا يعني أنت you should know it does not cause، شوفي كاتبها هون، does not cause bacterial vaginosis in association with other anaerobic bacteria. Anaerobic bacteria. Gardenalia, by the way, is facultative anaerobe. Okay? Facultative anaerobe. With another anaerobic bacteria, bacterial vaginosis is a combination of microorganisms together can cause not only one bacteria, other bacteria. So Gardenalia can be considered an associated bacteria with the other anaerobic bacteria in producing the bacterial vaginosis. نعم.
دكتور عندي سؤال بخصوص المحاضرة الماضية عن البابيلوما فيروس.
نعم.
حكينا إنه هذا الفيروس له فاكسينيشن. هل الفاكسينيشن تاعه يعني it's common ولا لا؟ لأنه يعني ما
شو الفيروس؟
اللي human papilloma virus.
CMV.
HPV.
الهيومن بابيلوما فيروس.
أيوة بالضبط دكتور.
لا human papilloma virus there are two vaccines, the bivalent and the quadrivalent available.
تمام، بس إنه كاستخدامهم مش كمون صح؟
نعم.
كاستخدام بحكي إنهم مش شائعين يعني في المنطقة عندنا ولا لا؟
يعني إذا موجود بالمنطقة بعض الدول بتعطيه for every girl from 9 years up to 13 and then to women because this is part of the screening. هلا مثلا in UK every woman will receive invitation to come for examination and checking for human papilloma virus. Human papilloma virus is a serious cause of cervical carcinoma. ولهذا السبب بعض الدول مو كل الدول طبعا يحتاج لها إمكانات كبيرة هذه، بعض الدول تعمل screening for every woman for cervical carcinoma. يعني تبدأ السكرينينج من عمر العشرينات، في بداية العشرينات 25 سنة يبدأوا يفحصوا النساء every 5 years for it. They advise to give the vaccine to those people just because cervical carcinoma is a dangerous condition, killer disease. Whether it's present locally or not, I am not aware about the details, unfortunately.
يعني ممكن نحكي المشكلة عندنا مش من ناحية الانتشار بقدر ما هي مشكلة إمكانيات هيك.
ما عندي تفاصيل عنها حقيقة، هذه ممكن واحد يستفسر منها من وزارة الصحة أو العاملين بمركز التطعيم في إربد إن كان موجود هذا اللقاح ولا لا. بس في غير دول موجود وفي screening program for every woman. نعم.
تمام دكتور، تمام، يعطيك العافية.
فإن شاء الله أنتم وصلتكم المسج هذه، إن شاء الله تكونوا قادرين على يعني متابعة هذا الموضوع في المستقبل إن شاء الله، من نصيروا أطباء بعون الله. احنا نزودكم دائما بالمعلومات الاب تو ديت. نعم. Other question? Any comment? Okay then. We have to stop here and see you inshallah in the coming lectures. السلام عليكم.
وعليكم السلام، يعطيك العافية دكتور.
الله يعافيكم.